This presentation on type 2 diabetes is for Ethan Anderson's Structure and Function of the Human Body course for the 2015 fall quarter. One of the most alarming statistics comes from the World Health Organization that estimates that obesity has doubled since 1980. Over 1.9 billion adults worldwide are overweight, and over 600 million are obese. Obesity promotes insulin resistance and accounts for approximately 80% of the population's attributable risk factor for type 2 diabetes. If we were to break this down for the United States, it would look something like this. Worldometers.info estimated the world population in 2015 at 7,214,958,996. and the U.S. population at 320,090,857, which equates to approximately 4.45% of the world's population. However, the largest chunk of obesity on the planet is in the U.S., with a whopping 13%. That means 247 million people in the U.S., or 80% of the population, is overweight or obese. Obesity contributes to heart disease, stroke, high blood pressure, some cancers, gallbladder disease, gallstones, osteoarthritis, gout, breathing problems, and type 2 diabetes. To further illustrate obesity in America and to truly realize the weight, pun intended, of this epidemic, you will note that no state in the entire U.S. reports less than 20% obesity, according to the CDC. The Midwest has the highest prevalence of obesity at 30.7%, followed by the South at 30.6%, the Northeast at 27.3%, and the West at 25.7%. As we learned previously, obesity promotes insulin resistance and attributes to the risk of developing type 2 diabetes. However, what effect does this have on our body? Insulin is made by the pancreas. After you eat, the sugar levels in your blood rise and insulin is released into the bloodstream. It then makes cells in the liver. Following, muscle tissue absorbs the sugar from the blood. If insulin metabolism is not working properly, the sugar in our blood cannot be used in the right way, causing blood sugar levels to rise. In people with type 2 diabetes, the pancreas is not able to keep up with the insulin required, causing blood sugar levels to rise. Hyperglycemia is the effect of high blood sugar levels. Contributing factors for type 2 diabetes are obesity, poor diet, and sedentary lifestyle. Symptoms of type 2 diabetes can include feeling very thirsty. Normally, our bodies reabsorb glucose as it passes through our kidneys. But in type 2 diabetes, blood sugar levels are pushed up and our bodies are unable to bring it all back in. However, it compensates for this by making more urine, creating the need to pee more frequently, and the need to increase fluids to replace the excess fluids we are losing. Intense hunger and fatigue are also common symptoms. When our bodies convert the food we eat into glucose, the cells we use for energy, we also need insulin to bring the glucose in. If our bodies have become insulin resistant, the glucose can't get into our cells, leaving us with no energy. Our bodies compensate for this by wanting us to increase our food intake to try to get glucose and energy into our cells. Other symptoms can include dry mouth and itchy skin, blurred vision, slow to heal sores or cuts, and pain and numbness in your feet and legs. If type 2 develops, then one will almost certainly develop complications associated with this disease, including retinopathy, where blood vessels in the retina leak, causing blurred vision and eventually blindness, skin infections, and cardiovascular disease, including high blood pressure and hypertension. Type 2 diabetes is a progressive disease and will get worse if left untreated. Long-term complications include micro and macro vascular complications, which can be marked by stroke, peripheral vascular neuropathy, painfully affecting one's lower extremities, and finally, death. Type 2 diabetes is a grim reality. However, it is successfully treated with lifestyle changes that include diet, exercise, and weight reduction. It's important to know that diabetes is preventable. However, educational intervention is imperative. Knowing the risk factors and understanding the disease will help prevent inevitable health complications. Education will help you learn the dangers of eating processed foods and how manufacturers knowingly increase sugar content in processed foods to preserve their shelf life. Battling the bullshit also include getting informed on creative ways our policymakers are trying to combat high fat and sugar in our food. One idea has included instituting a fat tax on foods high in fat and sugar, whose consumption contributes to obesity and type 2 diabetes. Okay, so we know that type 2 diabetes is successfully treated with lifestyle changes that include diet, exercise, and weight reduction, but you don't have to tackle this monster on your own. There are nutritionalists and dietitians that can help you learn more about the foods you eat and how to truly balance your diet. Additionally, getting a workout buddy can help ensure you stay motivated to make exercise part of a daily routine. In conclusion, we've learned that obesity is at epidemic levels. Obesity promotes insulin resistance and accounts for approximately 80% of the population's attributable risk for type 2 diabetes. In addition to obesity, poor diet and sedentary lifestyle contribute to type 2 diabetes. Diabetes is progressive and wreaks havoc on the body with complications that, if untreated, are grave. Diabetes is preventable with lifestyle changes that include diet, exercise, and weight reduction. Learning more about this disease and its prevention are critical. Success? That depends on you. Thank you.